Next is Senator Blunt Rochester.
Thank you, Chairman Cassidy, and thank you, Ranking Member Sanders, and to the panelists, thank you for being here. Delaware has recognized how crucial continued access to benefits like retirement are to persons' economic stability, and as we heard, even the economic stability of families. I was really struck, Ms. Friedman, by the remark that you made of individuals being more afraid of running out of money than dying. That really stuck with me. I can tell you this issue of making sure that, as you mentioned, Social Security was an anti-poverty program for our seniors, making sure that people actually can live out their lives with dignity and be able to feed themselves and be able to live is certainly important. And I will say in my state, in 2024, our Delaware State Treasurer rolled out a program called Delaware Earns, and it's a retirement plan that makes it easier for the 150,000 Delawareans without access to work-based retirement plans, including independent contractors, to save for the future. Ms. Friedman, how common are plans like Delaware Earns, and are they generally successful?
Thank you for that question. Yes. First of all, I want to say that the Pension Rights Center has been on the ground floor of supporting these approaches. So we had a common ground initiative called the Conversation on Coverage in the early 2000s, and one of our recommendations was to do some sort of state-administered plan. We were involved early on with Washington, Connecticut, Illinois, and other programs. So there's probably about 20 states that have implemented this kind of plan. Again, they're modest. They're not Senator Sanders' bill, right? They're not offering, defined benefit plans to everybody, right? But they are, they're expanding coverage for private sector workers who now do not have access to an employer-sponsored plan. So my understanding is that there's hundreds of thousands of now individuals who are participating in these plans. Employers are getting more enthusiastic, and there's been about, I think it's about $2 billion saved overall. So congratulations on Delaware in setting up the plan, and we'd like to work with you in any way. There are, additional protections we'd like to see in these plans. We'd like to be able to see the law changed at a federal level so that employers can contribute, because certainly, as Senator Sanders pointed out, you really need, and this is part of our principles, you really need employer and employee contributions if you're going to try to get adequacy. Also, we're looking forward to seeing the Savers Credit that was in Secure 2.0 actually implemented.
You're actually answering my next question.
Oh, good. So because that is a government match for low and moderate wage earners in IRA's 401k plans, and we think that's super important. We'd like to see Congress really working to implement the Savers Match and even make it high, expand it in terms of eligibility and also in terms of the amount.
Can you talk about how the Savers Match would work in practice and why this is such a big deal for both the traditional employees as well as independent workers?
Well, okay, I think that we're still waiting to see how it's going to work. But the idea, I think, would be that if low and moderate wage earners put in money, then the government would match that. So that becomes almost like an employer match. It's super important for low and moderate wage earners. It's something the Pension Rights Center and most consumer retiree and other organizations have worked on for a very, very long time. We were really happy when it was passed as part of Secure 2. We now need to improve it. So I think we have to work on the what I would call the incremental and the large. So, and that's where the Pension Rights Center is. So we're going to be doing a conference in 2026 as part of our 50th anniversary celebration, and we're going to be continuing this dialogue.
Thank you so much. I had the opportunity in my state to serve as the state personnel director, so the pension office was within our purview, and also benefits and dealing with benefits, and particularly healthcare as well is of concern to me, and I hope that we really take seriously the fact that there are so many people in this country that still don't have access to affordable health care, and that we continue to try to work together to make it strong. I think when we start chipping away at the Affordable Care Act and chipping away at Medicaid and chipping away, it moves us further away from our goal. Thank you. I yield back.
Thank you.